Well, hello everybody, and welcome to the summing up and the closing. What a formidable conference, what a formidable group you all are. And the learning that we've actually managed to put together between us, the insights, absolutely incredible. Given ourselves a lot of work to do. And I think the first and the closing message will be, is the overarching message through everything in this conference has been the need to collaborate. We need to work together to actually achieve what we need to do. So next slide, please, Deborah.
And you were all there for us. This was our first virtual conference. We weren't sure how it was going to work out, but thanks so much to everybody who attended.
We'll have a little whistle-stop tour through, what's been going on. So if we looked at medical session 1 on diagnosis management, active surveillance, watch and wait, and first-line treatments, a few take-home messages that have come in through the boxes. CLL is variable in how it presents and behaves. Many will never need treatment. These are learnings we've had. Treatment is not usually needed at a time of diagnosis. Testing for prognostic and predictive markers before treatment always helps determine the best choice of the therapy. Where available, novel oral therapies with or without intravenous monoclonal antibodies are the best treatment choice. That emphasizes the move away now in CLL from chemoimmunotherapy where you can in countries where it's available. And we know some of our group here, it is possibly not. And that's where we need to advocate as a community for change. Good take-home message, treatments keep getting better and patients are living longer. Okay, so there's a positive message at the moment that we can give our patients. Next slide, please, Deborah.
Sorry, folks. So our next medical session was a panel talking about emotional and psychological challenges living with CLL diagnosis. And I think you'll all agree that it stress that it's really important to connect our patients even during this time of physical disconnection. The emotional impact of diagnosis in the early days is considerable and continues on watch and wait, active surveillance, or if you're in treatment. And know that psychological care may be needed at various intervals along the treatment pathway. It's a continuous process.
Thank you, Deborah. Advocacy session 1, evidence-based advocacy, creating evidence for advocacy. Probably one of, for me, a really fascinating lesson, having just undergone the exercise of the survey with you all. Learned a little bit retrospectively actually from that slide. I think I would have benefited and we would have benefited from some of the lessons from those slides before, but we will get there, and thank you everybody for your work in that area. So evidence-based decisions are important for all we do as patient advocates. We need this to be credible. It's hard to dispute facts. This is how we create our facts to actually influence the activities that we need to make changes in. We learned how to use evidence-based research methods to develop and conduct surveys, and the importance of taking the time to do it right. I think this is part of the problems we all have. We've been guilty with this. If you can't do it in the time and can't do it properly, we just need to pull back. We need to recognize, as Zach pointed out in his study, how much time is needed at the front and the back end. Now, the results from CLLAN's global survey were presented by Deborah and Michael, and I think I had a go at summarizing earlier, and for evidence for development of the Horizons agenda, which I hope you feel by listening to you has made a difference to the content. And obviously, most importantly, as ways to move forward in addressing the unmet needs. And I come back to that word again, collaboration. We need you. We all need to get together. I also hinge on what Jana just said in her last statements there. Let's not leave it too long. We're digitally empowered now. We're used to these meetings. Why don't we now start forming some working groups so we can actually look at some of these ideas and come up with something meaningful and work together to make changes? One thing I'd like to say on the note of collaboration, I'm going to use this as a flag to raise it. On the study of topic of surveys, as Zach raised it in this session, we have got a global patient survey out at the moment that's looking for patient experience. we need, and we would like, if you could, to disseminate that to members, to patients, because we need the information on the ground of the patients, because that will also align with the survey you gave us, so that we can actually compare the two perspectives, and most importantly, we can act on HTA and access. We've got a lot of new treatments coming at the moment. We need that information, as Charlotte and the HTA group with Deborah pointed out. Next slide, please.
Well, I hope most of you attended this symposium, because it was really interesting to hear those top leaders of the clinical CLL community show real empathy for patients and patient advocates. And they also brought out their side of their frustrations in terms of shared decision-making. We hope that their commitment is reflected across different jurisdictions, and that we have a real hope of engaging in shared decision-making on the ground and for individuals. Patients need empowerment for all levels of health literacy to be confident that they can have influence. And we need doctors to have empowerment to help facilitate this.
Thank you, Deborah. Shared medical decision. The panel discussion, living with an endemic pathogen, supporting CLL. This was a particularly revealing and active session, and Renata was terrific, as well as a clinician there. A very mixed panel. I can see you all there. CLL patients are particularly at risk regarding COVID-19. Well, that's been a take-home message on every aspect. I think it's been hard to get away from COVID. Key lessons: vaccines are less efficient for patients across access to alternative strategies. For immunization strategies are of utmost importance, because obviously as well as the population not getting full protection and the disease still being transmittable from the vaccinated, it's going to reach patients that don't get a response. So we know that's a core message. We need access to these new technologies, these new treatments that are coming through, the monoclonals that are targeted. We need access for our patients and to the recently launched antivirals. The rising infection rates and reduced safety precautions have put CLL patients and their clinicians under stress. Well, that's an understatement, and even more of a stress when even post peaks in the crisis, you've got the healthcare community now dealing with backlogs caused by it, and under stress, well, patients, of which many of us are still locked down. This should be considered by governments, but politics may adversely influence decisions. Well, Natasha and your group covered some of this earlier. We need to unite. Collaboration comes back in there again. If we're going to influence policymakers, we need a larger voice. We are just a small, tiny little chink. Of that 2.5% that don't get a response, as was pointed out in Natasha's session, what percentage are we of that 2.5%? I don't think we're very much. So we're going to have to do that. A patient's individual behaviour should be the result of a shared decision-making between clinician and patient to balance risk. Well done. Renata's brought that to that discussion as well. So what a lovely session that was. Next slide, please.
Panel discussion on choosing advocacy priorities. And I think this is critical right now for all patient organizations, as you've had to switch to digital in different ways. Using Facebook was a solution for some, and could offer peer support and keep people up to date without cost. We did find that the pandemic hasn't affected all groups the same way, and there are significant differences by country. For example, in Tanzania, issues remained the same. The pandemic did not impact on their progress or work. Ireland, on the other hand, had to shift considerably, engaging in advocacy more than ever. If doctors are not prepared to switch to digital for giving their talks, patient groups cannot deliver virtual programming. For patient groups to adapt, they have to have the support of their community.
Thank you, Deborah. Advocacy session 2. This was one that I partook in last night. Some really great lessons and got stuck on a word there. Important for patient organisations to have good connections with haematology. That was one of the messages came out of that to actually implement the initiatives, the different initiatives that are shared. It's important that there is engagement with the clinical community so that they can provide information to patients. Advocacy campaigns can achieve results for patients. We know that. Our survey has showed that we don't think we're very good at it, although it's the second most involved topic that all of us are involved in. So again, let's look at the collaboration word. Let's look at what came out of that last session. We need a larger voice. If we're going to make an impact with our campaigns, we need to work together. And well, advocates need to learn from each other's best practice to advocate for our communities. That says it all. That's the reason for us coming together as a network. That's the reason for the survey. And that's why we really would like to make sure that we ensure that we make the opportunity for you to be more connected with us so that we can all get together on a regular basis, as Jan has just said there, to actually do this. Thank you.
In our last medical session, I think it provided a lot of information. We had a lot of questions we couldn't even answer about this. So it's good to know that improved outcomes and reduced side effects have happened with novel therapies, and many more are now being approved and coming through the pipeline. We know that not all of the countries who belong to CLLAN will be able to access these, but we really hope that as time goes on, that will improve. We found that comorbidities and immunity-related complications are the main issue in CLL. Richter's transformation still has poor outcomes, but clinical trials and new strategies, fixed duration therapies, consolidation, and other novel agents will hopefully eradicate that. Research is underway to determine genetic drivers to direct therapies. And I think the more we know about genetics, the more we're going to be able to manage CLL.
Absolutely. Access to treatment and care, the data to HTA. Well, both of you and I are involved in this. I only caught half of this session, but I'm sure there were great take-home messages. I did catch most of it, and it was really fundamental foundation learning. It was great to actually hear the experiences from 4 different countries. Deborah, you've been involved in this yourself from the very beginning. It was because of you that I first got involved in HTA when I was at CLL Support. So you've been the driver of collaboration again. There's that word. Yeah. We've managed to actually get lots of drugs approved. We've actually made sure that we've been at the table and we've done it the right way because of collaboration. You starting the seeds going on that, working with CLL Support, working with Leukemia Care and CLL Canada. So it's great to have everybody on the stage there. And I hope everybody took home some lessons from that. And again, this is another area of a working group. I think we need to start looking at working groups in different areas where we can bring expertise together with those that would, need insights to actually address some of the challenges of different countries, because access is one of the greatest problems we've got. So take-home messages. 21%, 12 out of 57 are survey respondents currently participate in HTA, but it's something that 28% of our members would like to be more involved in. I've just said it. So we need to roll our sleeves up and get involved and actually work at it. Large and small advocacy groups can be involved in HTA. Each country has its own process. Absolutely. We'd like to learn more about your processes. I'm only familiar with the processes of the group who are around this table. So we need to come together to actually address this properly. And more importantly, collaboration comes in again. It's not only in the CLL landscape that we need access to drugs. Every single person that's attending this, if they're involved in other disease areas or, this is where we can work with larger organizations. We were talking earlier about education and materials. Groups like WeCan, Jan Geiser was talking about that yesterday. I believe Jan's actually now chair of WeCan, and WeCan's building a platform of educational materials. That we need to tackle these things by bringing appropriate tools and initiatives to members, and to do that we need to look at making sure we signpost that from our website. So again, there's that word, collaboration. Next slide, please.
I think this is a little bit out of order, but I think the messages are the same. Our access to treatment, care, and services. There's not one definition for good access to diagnostic treatment and care. It varies significantly from country to country. And healthcare capacity, insurance coverage, even ethnicity challenge, among others, are major factors. A world where every CLL patient has access to timely precision diagnostic best innovative treatment and holistic care is not realistic. We know that the next achievable level could be that, may have bigger impact for improving the patient experience.
Well, that was a fascinating session. Thank you, Deborah. It was fantastic listening to everybody sharing and speaking, and Natasha, extremely well moderated. I think some of the clear challenges were very vocally expressed, and Natasha's proposal there, I think, for a collaborative study and paper to help with actually pushing forward. We're hidden at the moment. We need to address the issues that were being raised here so that we can actually gain some purchase, so that we aren't just lost in the cracks. And again, we come back to collaboration. That was the broader talk here. Let's involve other organizations within the blood cancer community, because CLL is not, as was said in this session, CLL is not the only blood cancer group that have got issues around immunity and safety at the moment. There are several others that are impacted at the same level, if not more. And together we have a united voice and we will achieve something. Again, collaboration. Thank you. Next slide.
We just want to remind you that all sessions will be available on this event platform for on-demand view for 6 months. So go under the navigation menu for sessions, the same way where you access the live sessions.
Well, I thought you'd have enough of me saying this in my rather long talk earlier, so I won't really go to too much of that, just emphasize that we're working hard and we'll finalise the survey report and recommendations and prepare for publishing. But we're not going to do that without consulting with you first. So this is another reason why we need to come forward to actually address some of the issues that it throws up, get a bit more information, look at focus, appropriate focus on some of the areas for focusing, for recommendations. And we'll formulate a strategic plan to then address these issues. And to do that, we need to engage with you and collaborate. And sorry, I've lost my eyesight a minute. Survey finds use strategies and recommendations to develop from the survey to then determine our network priorities. So that was part of one of the core reasons of the survey. And then we'll develop global and recommendations together to bring you as part of focus groups from the community together to help tackling these specific unmet needs and recommendations. Again, it's collaboration, collaboration, collaboration. And we need to make with working practices a way that we can actually make it easy so that we can get together on a regular basis to do this. Build a global directory of CLL support services. That's already underway, so I don't need to touch on that. We're really looking forward to being able to share this, and hopefully it's going to be at the end of the year, at the beginning of next year, but hopefully it's going to drive a lot of traffic to your resources or to resources of others where it's needed. And again, most important of all, we need your help to expand network capabilities to address all of these unmet needs and everything that we've raised today. And they're not going to go away. Thank you. Next slide.
And a big thank you to all of those who made the effort to submit a poster, and also to those who voted for the posters. The top 3 poster award winners have now been chosen.
Deborah, can I let you do that? My eyesight is playing up.
Yeah. So Leukemia Foundation Australia is the winner.
Well
they received 10 votes, so congratulations to them. Morocco Amal has received 8 votes, and 7 votes were obtained by Argentina. So our winners will have 2 options to choose from, as we discussed the other day. One will, and it was difficult coming up with prizes for this because we wanted something that could be accessible globally and something that will help just promote your mental health and well-being at this time of crisis. So the first option is yoga lessons, and the second option is cooking workshops. So we will be in touch with the winners to determine what prize they choose.
Thank you, Deborah.
So I'd like to.
You carry on. You give the thanks. Yeah. they're coming from my heart, but they're in your hands.
Okay, so thank you to everybody who attended our sessions live. Those who agreed to moderate or speak at sections, those who submitted posters and abstracts. We know that was a lot of extra work for you, so it's much appreciated. And those who submitted materials and interesting content for your exhibition pages. Again, it's about collaboration, and seeing this information was really great. Seeing what people had developed for their posters and abstracts was really valuable. And there's still time to complete the feedback form for each day. If you haven't done it yet, please do so as soon as possible. And there are prizes to be won by the 2 top leaders. So submitting feedback means points, and points mean prizes. So here is your CLL Horizons Planning Committee and Support Team. And our thanks to all of them. This was our first virtual conference, and I think we will all admit that it's a lot more work than a face-to-face conference.
Well
but
done,
overall, team. There were very few glitches. Nick, do you want to add something there?
I would just like to thank you because, you know, you've been driving it, you know, and putting considerable amount of work in as a volunteer, and we've had time differences to deal with. You picked up the tab today. We didn't intend to be on the stage together earlier on, but with an internet glitch, you know, with you and back up there, dropped straight in seamlessly. I'd like to thank the organisers behind the scenes, because a lot of work's gone into that. Nicole, you've done a fantastic volume of work for this, and you've really handled things smoothly. Natasha, as ever, super efficient, smiling face, that says it all. And James, great work. And to the steering committee that have you know, carried out certain roles on this, thank you. I don't know what to say to this, but what I would I'd go back that one slide. I think I learned something from Natasha today that I won't forget. If you want to get somewhere quickly, do it on your own. But if you want to go far, do it together.
Great thought. And the CLLAN, the CLAN Steering Committee, thanks all of you for your participation. And sorry to those who missed the magic show. We had hoped it would be recorded, but there was a glitch in that. So unfortunately, we don't have that to show you.
I reckon he didn't want to share his secrets.
Yeah, maybe.
Oops.
Oops, 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 oops.
You need to press, go back to slide share. You're on. There we are. And I could. But there was a glitch in that. So unfortunately, we don't have that to show you. I reckon he did want to share his secret. You on slideshow? There we go. And listen, this is really important. Thank you to our sponsors. Without you, none of this would have happened. And it's just so thrilling to know that you're all behind us with this. And we look forward to working together in the future. And that really just leaves us to end the show. What a fantastic and wonderful conference. Thank you so much for everybody. It's been incredibly participative. So many people have played a role. And yet again, I'm an incredibly proud person to be part of such a large network. Thank you.